health and osteoarthritis is Dr. Adam Smith of Ortho Arkansas. And he's an orthopedic surgeon who specializes in hip and knee reconstruction. Thank you so much for being with us today.
Thank you for having me.
So tell us a little bit about keeping our bones healthy and how this all connects.
Yeah, well, as you get older, your bones age, and in addition to your bones aging, your cartilage ages, and cartilage is what lines your joints. So when it starts to wear out, it can cause pain and inflammation in your joints. So the best thing you can do to stay active is to continue to stay active.
Mm-hmm. About what age are we seeing osteoarthritis?
It's usually in people in their 50s, 60s, but it can be younger, 40s sometimes,
Right.
but it kind of varies on the person. But generally, as you get older, 40s, 50s, 60s.
Right. I was telling you my daughter has juvenile arthritis. Are the symptoms different for osteoarthritis? Like, how do we know when this might be a possibility?
Yeah, that's a little different. That's more inflammatory, and that can be autoimmune type stuff. General osteoarthritis is just a term that refers to joint inflammation. That's usually to cartilage wearing out as you get older.
So what are some of the treatments for osteoarthritis?
General treatments start pretty easy, stuff like over-the-counter anti-inflammatories, and then there are prescription strength anti-inflammatories as the pain increases, and then activity, so strengthening, physical therapy, stuff like that. You want to keep your muscles around the joint strong to try to support that joint and offload the pressure. And then there are injections that we can do in clinic to try to help with the pain.
So those are the things that you may try first, and then sometimes hip or knee replacements are needed.
Exactly. That's usually the end of the road, so that's reserved for when we've done everything we can do up to that point and you're still hurting and still having problems.
So if people are having pain, they need to talk to a physician. How do they know when it's time? Sometimes we just think, oh, I'm just getting older. This is just normal.
Well, you can start with your primary care doctor, or if you're just hurting, you can give us a call and come see us.
Right. And so do they go to their primary care doctor first and they will refer them to you, or can they come directly to Ortho Arkansas?
Either way.
Okay.
You can either call or you can talk to your primary care doctor and they can get you in touch with us.
Right. What are some of the more, I guess we just want to know about some of the symptoms for osteoarthritis more specifically.
Yeah. Pain is the main thing. Pain with activity, pain with normal day-to-day activity, stiffness when you first get up in the morning and it kind of loosens up as you get going. And then at the end of the day, you start having worsening pain in your hips or knees.
Right. And then hip and knee replacements, these can greatly help with these symptoms. How long are you down after something like that?
Usually, it's at the most, it's typically a one-night stay in the hospital. A lot of patients are going home the same day now.
Wow.
But generally, it's about a 4 to 6 week recovery. Sometimes even up to 3 months. It kind of depends on the person.
It greatly helps.
Yes, ma'am.
Hugely.
It's a quality of life procedure.
Yes, for sure. All right. So how can people find out more? They want to be evaluated, or they just want to find out more about Ortho Arkansas?
They can go to our website online, orthoarkansas.com, or they can give us a call or even talk to your PCP.
Perfect. All right. We appreciate you coming today.
Yes, ma'am. Thank you for having me.
Thank you. We'll be right back.